been tested will soon be sent to the FDA for approval.
And right now, we don't know just how soon that could be.
Meanwhile, some parents and doctors in the Lowcountry are anxiously awaiting that approval.
And not just to keep kids safe, but to keep them in school. Our Tara Jabor talked to a doctor at the Children's Hospital and CCSD's Director of Nursing.
Doctors at MUSC say they're excited about the news from Pfizer today. The vaccine for children ages 5 to 11 will be 1/3 of the dose of adults.
Pfizer was estimating by Halloween that it would be approved.
Dr. Eckard says MUSC has gotten a look at some of the data,
which looks very strong, both in terms of safety and effectiveness of preventing COVID.
At the beginning of the pandemic, children were not as affected by the virus, but Dr. Eckard says things have changed.
Since July 1st, we have seen an exponential growth in the number of children who have been admitted to MUSC and to other children's hospitals across South Carolina. And not just the number of admissions, but the number of severe cases.
Dr. Eckard says the news of a possible vaccine for younger kids could help school districts.
Children who are fully vaccinated do not have to quarantine after a close contact exposure, provided they stay without symptoms.
MUSC partnered with CCSD to vaccinate teenagers earlier in the pandemic, and officials say when the Pfizer vaccine is approved, that partnership will continue.
We are actively working with MUSC now so that when our next group of eligible children become available for vaccination, the 11-year-olds and under, that our plan is to get into the schools again as the school nurses and be able to vaccinate those children with the parental consent.
A clinical trial on whether or not Ivermectin works to treat COVID is now being tested at MUSC. That drug usually meant to prevent heartworms in some animals.
And while experts have cautioned anyone from using it at this time, the drug is getting the attention of some state lawmakers. Andrew James reports on the controversial drug sparking a partisan debate.
An attempt to stop the suffering.
People who get COVID are told to basically go home until they're too sick and have to go to the emergency room.
It's the topic in the SC Senate Medical Affairs Subcommittee. It started as a discussion over monoclonal antibodies, which have been used locally to treat COVID. But the discussion has now shifted to the political debate over another drug, Ivermectin.
This Ivermectin you're talking about is the same thing we used to use on my 17-year-old dog to perk him up to keep him from dying.
Despite not being an approved treatment by the CDC or FDA, there's a growing effort to see the drug as part of mainstream treatment for COVID symptoms in South Carolina.
I want us to ensure as a legislature that people have a right to try in South Carolina.
Advocates are not talking about the over-the-counter product, paste or pill, but what the doctor can prescribe.
The sanctity of the doctor-patient relationship needs to be preserved.
Tracy Diaz from Maury County spoke in support of the drug at the recent hearing. She and others say doctors have been threatened not to prescribe it, but what they are referring to is actually the advice from the FDA, American Medical Association, Pharmacists Association, the Society of Health, all saying don't take it and don't prescribe it. But Diaz says international data supports it. Some senators, they're not sold on the debate.
I think it's inappropriate to discuss treatment options with people who refuse to follow the science and advice of public health experts.
In the end, what the goal is for this discussion remains unclear.
Be knowledgeable.
All right, we're almost 2 years into this pandemic, and while for some people life is back to normal, inside hospitals is anything but normal.
Yeah, so our Amy Russo toured an ICU department at Roper St. Francis in Mount Pleasant, and she is now showing us the desperate situation healthcare workers are seeing at just one of our Lowcountry hospitals, a story you will only see on ABC News 4.
It's a door.
Maybe he just needs more time to recover.
You don't want to walk through.
There are 10. Every bed is full.
Is that like pretty consistent that they're all full?
Yes. These days, for sure. Definitely since we've been in this surge with the pandemic, it's been every day.
Every single person battling COVID, all unvaccinated, and all on a ventilator.
It does take a lot of nursing care. We try to prone these patients, put them on their belly at least twice a day, turning them when they're intubated, and we have a lot of the patients are paralyzed just to keep them from fighting the vent.
The average stay on the ventilator, nurses say is close to a month.
Unfortunately, once someone's on a ventilator, then it's a battle to see how we can get them weaned off of that.
This is our new gentleman we just intubated, but look at his pH and the CO2, how bad it is.
The survival rate once intubated, I'm told, less than 10%.
Every morning I come in, I have to make sure that it is working properly because you never know when a patient is going to crash. Literally an hour ago, before you guys walked through, we intubated a guy, and the first thing he said was, "Let me call my daughter," because honestly, it may be the last time he ever gets to, she ever gets to hear his voice. It's almost like we're helpless because, we're taught one thing and it's to save people, and we're doing all that we can, and sometimes that's not enough.
Leaving some families to make a heartbreaking decision.
That it can be one of the toughest decisions to ever make, is to, take your family member off of life support. But unfortunately, with the COVID patients, they are needing the life support. Otherwise, they would die.
He's not my patient. I don't really know anything about him, but he's saddened.
Paralyzed with a tube down their throat.
I've ever seen anything like this.
Arms pierced with needles, drips keeping patients alive.
It's torture being paralyzed, sedated. They can't move, they can't see their family members can't see them.
It's a reality some nurses say could be prevented.
No one should have to go through that when they could easily get a shot and be with their families for the rest of their lives and, not die in a hospital room alone.